Pick that up, sweetheart." That is what Dr. Whitfield said 48 minutes before his entire world collapsed. The words hung in the cafeteria air like poison gas, and Laura Bennett did not flinch. She did not tremble. She did not allow her jaw to clench even once in front of the 17 people who had stopped eating to watch. Instead, her hands moved on their own, muscle memory from places she would never discuss, and she bent to retrieve the scattered charts from the tile floor. The ceramic plate had shattered. Coffee pooled dark and spreading. She gathered the papers with mechanical precision, her movements controlled, her face showing nothing while her mind catalogued every detail: Whitfield's shoe size, the cut of his wedding ring, the specific angle of his smile that revealed something cruel underneath the authority. Cedar Creek Medical's pediatric floor hums with fluorescent lights and antiseptic burn. The hallways smell like bleach, and something underneath it, the metallic tang of fear that no amount of cleaning can eliminate. Laura moves through the ward with the kind of precision that makes other nurses unconsciously trust her. 6 months into her civilian nursing position at this San Diego hospital, she has become invisible in the way that the most dangerous people often are. The quiet competence that departments rely on. The steady hands that other nurses defer to without quite understanding why. Her chart reviews go deeper than necessary. Her attention to detail borders on obsessive. A tarnished challenge coin sits in her scrub pocket, smooth from 18 years of her thumb running across its surface whenever the weight of the world presses too hard. She touches it now, standing at the medication cart, the metal cool against her fingertips through the thin scrub fabric. The coin catches light when she reaches for it. 9-year-old Emma Mitchell arrives on the pediatric floor on a Tuesday morning with her father, Colonel Michael Mitchell. Air Force dress blues, crisp and pressed despite obvious exhaustion that sits in the lines around his eyes like a permanent guest. Emma is pale. Not sick pale, not the flushed fevered kind, something deeper. A pallor that suggests the life is draining out slowly, one day at a time, and nobody has figured out the plug. The chart is thick. Thicker than charts should be for a 9-year-old who should be worried about nothing more serious than recess and spelling tests. Laura's fingers pause on the file longer than necessary when she reviews it during her lunch break in the supply room. 20 different doctors. 20 different diagnoses. Chronic fatigue. Autoimmune dysfunction. Psychosomatic illness. That particular diagnosis makes something cold slide down Laura's spine. She has seen psychosomatic before. She has watched it used as a cover for incompetence, for laziness, for the kind of deliberate negligence that destroys children while everyone congratulates themselves on being thorough. Dr. Raymond Whitfield, Chief of Pediatrics, appears in Emma's doorway at 2:51 in the afternoon. His posture is immaculate. His smile does not reach his eyes, has never reached his eyes in the 6 months Laura has worked here, and she recognizes in his expression something she thought she had left behind overseas. A calculation. A measurement of value. A mental ledger where some lives weigh more than others. He watches Laura handle Emma's chart with the kind of focus that suggests she is simultaneously the least and most important person in the room. Already calculating. Already measuring. His pharmaceutical rep brother-in-law controls $6 million in insurance referrals annually. His connection to 3 board members stems from country club dinners and carefully placed donations. The military families here, he has learned, have the most generous premium coverage. They also have the least time to question billing, the least ability to navigate appeals, the most desperation to fix what is broken in their children. Emma's case represents everything Whitfield needs. A sick child. A military parent with comprehensive coverage. And a diagnosis that can be stretched indefinitely across endless specialist referrals, constant testing, bi-weekly follow-ups at his private clinic. The profit margin is exquisite. 3 months of careful management and he could generate 40,000 in billable hours alone. 6 months and he could double that. The miracle cure, a new combination of supplements, a dietary intervention, a treatment protocol he discovered himself, could arrive precisely when her insurance benefits begin to crest. Perfect timing. Laura sees it immediately. Not the specifics, not the billing scheme, not the deliberate cruelty of keeping a child sick for profit. But she sees a predator in a white coat, and something in her recognition must have shown because Whitfield's eye catches hers for exactly 2 seconds, and his smile shifts. Becomes less practiced. More genuine. More dangerous. He is not accustomed to being read by floor nurses. He is not accustomed to being looked at as if he is being measured for his actual weight instead of his credentials. The challenge coin in her pocket feels heavier. 3 days later, in the nurse's station at 3:15 in the afternoon, Whitfield makes his announcement. His voice carries the kind of casual cruelty that only exists in institutional hierarchies where power is absolute. He places a $50 bill on the desk, folded once, casual, dismissive, and speaks to the group of nurses while maintaining eye contact with Laura as she documents vitals from the previous shift. "I'll wager $50 that the new floor nurse quits within the week," he says. She doesn't have the stomach for this. Too much integrity. Too many questions. That kind of person doesn't last in pediatrics. The suffering, the reality of it, breaks them. Am I right, people? The nurses laugh with the nervous energy of subordinates afraid not to. Whitfield's authority makes silence dangerous. His smile makes compliance seem like friendship. Laura does not look up from her documentation. Her handwriting remains steady. Each number precise. Each letter formed with the kind of control that comes from years of recording information under far worse conditions than fluorescent lighting and office politics. She is aware of the weight of his attention like she is aware of breathing, present and ignorable. She has survived far worse than the casual contempt of a mediocre man in a position of power. The bet sits on the desk for 2 days. Nobody takes it. Whitfield seems almost disappointed. Then it is Thursday 11:24 in the morning, and the cafeteria is crowded with the lunchtime chaos of hospital staff. Laura stands in line with her tray, salad, water, the kind of careful meal that takes up space without causing problems. Whitfield approaches from behind. She becomes aware of him the way prey becomes aware of predators, a shift in air pressure, a sound that is just slightly wrong. She does not turn around. She does not tense. She continues forward in the line, and he walks beside her, and then, with no warning, with the kind of deliberate casualness that confirms intent, he knocks the tray from her hands. The ceramic plate shatters against the tile. The sound is sharp and specific, like a gunshot in a confined space. Silence crashes over the cafeteria like a wave. All motion stops. All conversation ends. Laura stands without moving, watching the food scatter. The fork clatters twice before settling. Water spreads in a dark mirror across the floor. Whitfield smiles that smile again, the one that shows teeth, and says it, "Pick that up, sweetheart." Not a request. The word choice is deliberate. The diminutive is calculated. The tone suggests she is something that has malfunctioned and needs to be reminded of its appropriate function. The room is holding its breath. 17 people are watching to see what will break. Her jaw clenches once. Exactly once. Then her hands move. They bend. They reach. They gather the scattered charts and papers from the floor with the mechanical precision of someone who has cleaned up far worse than broken dishware. A piece of the plate is still warm. Blood, she would later realize, but there is no blood here, only the ordinary destruction of ordinary things. She picks up each piece. She arranges them in her hands. Her face shows nothing. Not anger. Not humiliation. Not even resignation. The expression is blank in a way that somehow suggests depth underneath, as if she is looking at Whitfield from behind 3 feet of reinforced steel and he can sense it but cannot quite see through. The room remains silent. Nobody moves. Nobody speaks. The fluorescent lights buzz overhead with that specific frequency that only hospital lights produce, that sound that exists beneath human hearing until silence makes it audible. She does not say a single word. She stands. She disposes of the broken plate in the waste receptacle. She places the scattered charts on the counter. She walks out of the cafeteria at exactly the same pace she walked in. Her scrubs remain unruffled. her posture unchanged. The challenge coin in her pocket presses against her ribs like a heartbeat, and she touches it once, just once, as she passes through the double doors into the pediatric ward hallway. Whitfield's smile fades. He had expected tears. He had expected an apology, a retreat to the bathroom, some kind of visible break. Instead, he received perfect composure. Refusal to perform the humiliation he had choreographed. And in that refusal, something shifted. The other nurses look away from him instead of toward him. The cafeteria resumes its noise, but the pitch is different. Whitfield stands alone by the scattered dishware, and for the first time, he understands that he may have miscalculated. He does not yet understand how badly. But that wasn't the worst part. 2 days later, Laura is suturing a laceration on a 12-year-old boy in the trauma room when a Navy corpsman, lanky, freckled, wearing the kind of exhaustion that comes from a 14-hour ER shift, pauses in the doorway. His eyes track her hands. The precise angle of the needle. The specific knot she ties. The technique that has no variation because it was trained into muscle memory in a place where mistakes meant someone died in your arms. She uses 4.0 nylon, the clean interrupted stitch, the exact same method she learned in Tikrit in 2009. The corpsman's face shifts. Recognition floods it. His voice drops. He says quietly, moving closer, Tikrit. 2009, you ran the trauma tent outside the forward base. Not a question. A confirmation. You were, he stops, searching for the call sign. You were Valkyrie. The room goes still. The suture sits between the boy's skin and the needle. Laura does not move. Does not look up. Does not acknowledge the words hanging in the air like radiation. She ties the final knot. She snips the suture. She looks up only once, making eye contact for exactly 1 second, and something in that look, something carved from stone and starlight, makes the corpsman step back. Step all the way back. She says nothing. Not confirmation, not denial. Not even acknowledgement. She simply finishes the dressing, disposes of the needle in the sharps container, and walks past him out of the room. Her hand moves to her scrub pocket as she walks. The challenge coin, smooth and worn and tarnished, presses against her skin like a secret that has been waiting 18 years to be remembered. The corpsman stands in the trauma room alone, holding the knowledge of what he has just witnessed, and he does not say another word. The morning rounds at Cedar Creek Medical moved like clockwork, stethoscope, clipboard, dismissal. Dr. Raymond Whitfield led the pack of residents through the pediatric wing, Emma Mitchell's chart in his hands, his voice carrying the practiced authority of a man who'd never been questioned. He stopped at Emma's room, glanced at the chart, then looked directly at Laura, who stood at the bedside with Emma's vital sheet. Nurse Bennett, he said, his tone suggesting he was about to explain something very simple to someone very slow. The weakness presents as chronic fatigue. The parents report malaise. The previous consultations, he flipped through the chart with deliberate slowness, 20 specialists, 20 different perspectives. This is textbook fatigue syndrome in an anxious child. Laura had been taking notes on Emma's symptoms for 6 days. The pattern was wrong. The weakness wasn't steady, it came and went in waves. The heart rate elevated slightly during the episodes. The lip discoloration appeared for 30 seconds at a time, then faded. Doctor, I've noticed something in her presentation pattern. The timing of the weakness episodes doesn't align with emotional triggers. There's a cardiac component that, Whitfield's laugh cut through the hallway like a blade. The residents froze. Your calling is observation of vital signs, Nurse Bennett. Not interpretation. Not diagnosis. Not playing detective with a stethoscope. Leave the thinking to those of us with the appropriate credentials. He turned to the residents with a smile that didn't reach his eyes. This is what happens when civilian nurses attempt clinical analyses. It's cute, really. One of the residents looked away, embarrassed for her. Another checked his phone. Laura's jaw clenched, a single, almost invisible contraction of muscle, but her voice remained steady, deferential. Of course, Doctor. My apologies. She turned back to Emma's monitors, but her mind was cataloguing something else, the way Whitfield's hand lingered on Emma's chart, the way he'd already made his decision before entering the room. 3 days passed. The cafeteria was crowded with the lunch hour crush, nurses, technicians, dietary staff, families. Laura carried her tray past the table where Whitfield sat reviewing his phone. She didn't see his foot extend until the tray was already airborne. Soup splashed across the tile floor. The plastic cup cracked. Napkins scattered like confetti. The room went dead silent. Conversation stopped mid-sentence. Whitfield didn't look up from his screen. "Clumsy," he said, his voice loud enough for everyone to hear. "Maybe nursing isn't your calling, sweetheart. You're spilling things left and right." A young nurse named Stephanie moved toward her with an offer of help. Laura shook her head once, a small, definitive gesture, and knelt to gather the debris. The smell of tomato soup mixed with the cafeteria's industrial cleaner. Her hands moved methodically, collecting each piece of plastic, each soggy napkin, each chip of ceramic. Around her, conversations resumed, careful and low. She could feel the weight of attention, some sympathetic, some satisfied, all of it watching to see if she'd break. She didn't. She stood, disposed of the trash, and walked back to the floor without a word, though her jaw worked once, hard, like she was grinding something between her teeth. The challenge coin in her scrub pocket felt heavier than it had that morning. By afternoon, the humiliation had escalated. Whitfield appeared at the nurse's station with Emma's chart and 6 others, all stacked unevenly. He set them on the counter in front of Laura, then knocked them to the floor with the edge of his hand. Papers scattered across the tile in a fan pattern. "Pick that up, sweetheart. And maybe focus less on playing detective with your little theories and more on basic nursing tasks. Your pay grade is paperwork and vitals, not diagnostics." Laura bent slowly. She gathered each chart, aligning them with precision, stacking them according to patient room number, then placed the stack on the counter. Her movements were controlled, deliberate, showing nothing. "Is there anything else, Dr. Whitfield?" Her voice could have cut glass, perfectly smooth, perfectly level, perfectly devoid of emotion. He smiled. It was a smile of victory, of a man who believed he'd successfully broken something. "That's what I thought." He walked away. But Laura hadn't broken. Her composure during the humiliation wasn't resignation, it was the restraint of someone who'd survived far worse than a dropped lunch tray. The trembling wasn't fear. It was something else entirely. That afternoon, Emma's condition deteriorated. Laura noticed first the subtle bluish tint around Emma's lips during routine vital signs, the slight distension of the jugular vein, the way Emma's breathing had become labored. When Laura placed her stethoscope against Emma's chest, the heart sounds were muffled, distant, as though the noise was coming through water. She paged Whitfield 3 times. No response. Emma's oxygen saturation dropped from 92 to 88 to 83. Laura moved to the bedside with her vitals equipment, and something shifted in her bearing. The careful deference evaporated. Her movements became precise, economical, clinical. She recognized cardiac tamponade, fluid compressing the heart, something that none of the 20 previous doctors had caught. The signs were there if you knew what to look for. If you'd seen it before. If you'd held patients through it while mortar rounds fell outside a trauma tent. A Navy corpsman named Rodriguez arrived from the ER with the crash cart, called by the nurse's station. As he helped position the equipment, he watched Laura work. She prepped the ultrasound probe with steady hands. Located the pericardial space with the confidence of muscle memory. Positioned a 14-gauge angiocath needle with the kind of precision that made the resident physician step back involuntarily. The needle slid in. The hiss of fluid escaping. The monitor showed Emma's blood pressure climbing. 71. 82. 89. Stable. Emma's oxygen saturation began its climb. 90. 92. 94. Sinus rhythm. Rodriguez watched the entire procedure unfold, and his face went very still. That was a combat field technique. That was triage medicine. That was not civilian nursing. After Emma stabilized, after the residents had filed out and the equipment was secured, Rodriguez found Laura in the supply room. She was restocking saline bottles, her movements methodical, as though performing an emergency pericardiocentesis was just another afternoon task. "Tikrit," he whispered. His voice was barely audible. 2009, you ran the trauma tent outside the forward base. FOB Shank. I was with 3rd Battalion, 5th Marines. Dark Horse Company. I watched you suture a Marine who took shrapnel to the femoral artery. You used the same technique just now. The same angle. The same hands. Laura didn't stop restocking. She didn't look at him. Her face remained completely neutral, a mask so perfectly constructed that it revealed nothing. "You're mistaken, Corman." Her voice was steady, quiet, dangerous. She reached for another bottle of saline. "I'm just a nurse." "You're Valkyrie," Rodriguez said. "The Marines called you Valkyrie because you wouldn't let anyone die. Not on your watch. Not ever." Laura set down the bottle and turned to face him. Her eyes were the color of winter Atlantic, and they held something that made the corpsman understand, in that instant, that he'd just made a very serious calculation error. She stepped closer. "If you say that name again, Corman, if you speak a single word of what you think you know, you will compromise an operation that could protect hundreds of service members and their families. An operation that has been in development for 6 months. An operation that I cannot complete if my cover is blown." Rodriguez's mouth went dry. You recognize a technique. You remember a time. But you do not remember my face, because you weren't looking at faces in 2009. You were looking at blood and wounds and the difference between living and dying. You're mistaken. And you're going to continue being mistaken. She walked past him toward the supply room door. "And Corman." Her voice stopped him at the threshold. "Thank you for your service." She didn't wait for a response. She returned to the floor where Emma Mitchell was breathing steadily, color returning to her small face, her father's prayers finally being heard, even if neither of them knew that the woman who'd saved her carried medals and memories that would have changed everything. The challenge coin in Laura's pocket felt like it was burning through the fabric. Rodriguez stood alone in the supply room, surrounded by bottles and bandages, holding the knowledge of what he'd just witnessed, and he did not reach for his phone. Emma's lip was blue. Not pale. Blue. Laura saw it in the peripheral drift of her vision first, a subtle shift in the monitor light, a change in the quality of the girl's breathing. The examination room at Cedar Creek Medical smelled of antiseptic and something underneath it, something metallic and sharp. Laura's hands continued their practiced assessment across Emma's abdomen, but her eyes had already catalogued the subtle signs. Jugular vein distension. The kind of shallow, labored breathing that came from compression, not disease. Muffled heart sounds, barely audible through the stethoscope even in the silence of the exam room. Whitfield stood in the doorway, reviewing lab results on a tablet, barely looking up. He'd kept Laura off Emma's case for 4 days straight, assigning her to the geriatric ward, a deliberate erasure. This was the first moment he'd allowed her proximity to the girl since the cafeteria incident, and only because the attending resident had called in sick. A gap in the schedule. An accident of timing. Emma's color was deteriorating. Not gradually. Not over hours. Right now. Laura watched the child's chest rise with effort that shouldn't have required so much effort, and every nerve ending in her body went quiet and alert, the way it had in Tikrit when the convoy came under fire. The challenge coin pressed against her ribs, a small weight that meant nothing to anyone else. "Emma, I need you to sit very still for me." Laura's voice was measured, the deferential tone of a nurse requesting permission. Not a command. "Not yet. Dr. Whitfield, I need to listen to her chest again. Can you come look at this?" Whitfield didn't look up. "Run a chest X-ray. Order another metabolic panel. And get her full cardiac workup from cardiology. Again." He turned away, already typing something into his tablet. Laura felt the moment stretch. The room temperature seemed to drop. Emma's mother wasn't present, Colonel Mitchell was at the base, and Whitfield had been explicit about limiting family visits, calling them overstimulating to the patient. Now it was just Laura, a 9-year-old girl turning the color of twilight, and a doctor walking toward the door. Laura made a choice. Stay with me, Emma. Breathe slowly. In for 4 counts. Laura's hands moved to the emergency cart against the wall, smooth and efficient. No hesitation. No permission asked. Doctor, I need a 14-gauge needle and a sterile field. Stat. Whitfield spun around. His face was a question that turned into anger. What are you doing? His voice had that particular edge that meant he was calculating how to weaponize the moment. Step away from that cart. Cardiac tamponade. Laura was already assembling the needle, the syringe, the drape. Her movements were the kind of precise that only came from muscle memory measured in years, not months. Pericardial fluid compressing her heart. The muffled sounds, the JVD, the respiratory distress pattern. She's crashing. You are not authorized. She's in distress right now, doctor. Laura's voice didn't rise. It dropped. Steadied into something that made 2 residents standing in the hallway stop moving. Are you going to help her, or am I doing this alone? The silence that followed was the kind that stretches across seconds like water before it freezes. Whitfield stepped toward her, his face darkening. If you touch that child without my explicit authorization, I will have your license revoked before. Emma convulsed. A small, subtle thing, but enough. Her oxygen saturation had been creeping down for the last 90 seconds. Laura had been watching the monitor with the part of her attention that never fully left tactical awareness. Now it spiked with a warning sound that cut through Whitfield's threat like a blade. 68%. Then 65%. Laura moved. She'd learned pericardiocentesis in a trauma tent outside FOB Shank in 2009, with mortars landing 300 meters away and a Marine's heart failing under a pressure that no surgeon could reach in time. She'd done it 17 times in field conditions, with no ultrasound and no backup, because the alternative was watching someone die from something that took for minutes to fix. The needle went in at the 5th intercostal space, left of the sternum. The angle was precise, 30 degrees, aimed toward the left shoulder, through skin and fascia and muscle and pericardium. She felt the distinctive give of tissue parting for the needle, and then the sudden loss of resistance that meant she'd entered the pericardial sac. The syringe filled with fluid. Dark, infected-looking fluid that had been compressing Emma's heart for days while 20 different doctors ran tests and ordered consultations and documented chronic fatigue in her chart. Emma gasped. Actual breathing, sudden and deep, as the pressure released. Get me a sample container, Laura said. Not asked. The tone had shifted. The words were no longer a nurse's request, they were a command, the kind that made residents move without thinking. I need this fluid typed and analyzed. Now. One of the attending residents, a man named Chen, no relation to the Johns Hopkins legend, but carrying himself like he wanted to be, he stepped forward with a sterile container. His hands were shaking. Laura's were steady as the surgical laser she'd studied in a classified pre-deployment briefing about vascular repair techniques. The fluid drained into the container. Emma's oxygen saturation ticked upward. 68. 72. 80. 85. The heart monitor's rhythm stabilized from the erratic flutter it had been producing into the steady, reliable sound of a heart that could actually pump. Laura withdrew the needle with the same deliberate precision she'd inserted it. The crisis wasn't over. The diagnosis was just beginning. Whitfield was frozen in the doorway. His face had gone the color of old bone. This fluid is infected, Laura said, her eyes on the container. Not bacterial infection. Autoimmune. Likely pericarditis triggered by a systemic immune condition. She looked up at Chen. Run an ANA panel, antihistone antibodies, ESR, CRP, and get a rheumatology consult. Not tomorrow. Now. You can't, Whitfield's voice cracked. Literally cracked, like he was 17 and his voice was changing. You are not authorized to. I just saved your patient's life, doctor. Laura's voice was quiet. The quiet that comes from exhaustion, or from killing, or from both. The diagnosis is juvenile autoimmune pericarditis with secondary pericardial inflammation. All 20 specialists you sent her to missed it because none of them bothered to do what a competent clinician does. She turned to look at him directly. Ask why the pericardial fluid wasn't analyzed in the initial workup. Whitfield's face went through 3 colors. Red. Pale. Red again. Emma was breathing normally now, her color returning to something approaching human. Her eyes were wide, frightened, but aware in a way they hadn't been for days. The compression was off her heart. The body knew what the mind couldn't yet articulate, it was being allowed to function again. Laura set the sample container on the counter with careful precision, the kind that emphasized finality. She turned to Emma's bedside and took the girl's hand, checking her pulse. Strong. Steady. The kind of pulse that meant everything that was supposed to happen next was going to happen. You're going to be okay, Laura said to Emma, and meant it with a certainty that came from understanding physiology the way other people understood breathing. You're going to feel better very quickly now. Once we treat the underlying condition, your body can recover. Whitfield made a sound. Not words. A sound like something breaking. He turned and walked out of the examination room, his tablet gripped so hard his knuckles had gone white. Laura heard his footsteps quicken down the hallway. Heard him on his phone before he'd even made it to his office, his voice tight and controlled in a way that meant he was about to make decisions that would have consequences. She'd known, in the moment she picked up the needle, that this choice erased options. The compliance, the invisibility, the patience, all of it was gone. She'd revealed something in the steadiness of her hands, in the command tone of her voice, in the way she'd moved through a procedure like it was muscle memory and not a violation of every institutional boundary that existed. But Emma was breathing. The fluid was draining. The diagnosis was correct. And that coin in her pocket, the one she'd carried since Tikrit, tarnished from years of being pressed against her heart, meant something different now. The fluorescent lights hummed overhead like a warning. Dr. Whitfield's hand shook as he dialed. Not from guilt, he'd moved past guilt somewhere around his 3rd year of maximizing insurance claims, but from rage. Fury that a suspended nurse with a scrub pocket full of secrets had upended 18 months of careful financial engineering. His office door locked. His voice dropped to the tone he reserved for people who understood leverage. The hospital's chief financial officer answered on the 2nd ring. I need the board called. Emergency session. This afternoon. Bennett's reckless cowboy medicine nearly killed that Mitchell girl. Unauthorized procedures. Violation of the chain of command. I have witnesses. The CFO made a sound like a man who'd just been handed a grenade with the pin already pulled. Dr. Whitfield, I'll make the calls. But this needs documentation. Documentation. Whitfield smiled. He had 14 pages of fabricated incident reports already drafted, each one detailing Laura's supposed violations of protocol, her aggressive insubordination, her dangerous deviations from standard pediatric care. The narrative was simple: she was a threat to patient safety. A loose cannon who thought she knew better than 20 years of medical training. By noon, the CFO had called every administrator who mattered. Hospital CEO. Board chairman. The 3 attending physicians who'd watched Laura perform that impossible procedure and stayed silent because Whitfield still controlled their referral patterns, still assigned them the lucrative cases, still made their professional lives smooth as polished marble. Whitfield activated the next layer. Insurance company contacts, men he'd cultivated for 3 years with strategic dinner invitations and carefully timed referrals. I'm seeing patterns of excessive testing, unnecessary interventions, unauthorized expenditures, he told them. This particular nurse is driving up your claims without authorization. She's a liability. The insurance company representative, a woman named Cynthia who'd sent Whitfield a $500 gift card last Christmas, made notes. The pattern was forming. The narrative was hardening. By 2 in the afternoon, Cedar Creek Medical had officially suspended Laura Bennett pending investigation. No pay. No access. No badge. Her credentials revoked until the board could determine whether she posed a threat to patient welfare and hospital integrity. The suspension letter was hand-delivered by hospital security at 3:15 p.m., while Laura was still sitting in the break room, her shift technically over, her mind still in the operating space where Emma Mitchell's lips had gone from blue to pink. She read the letter without moving her jaw. Without flinching. Without letting her hands betray anything except the muscle memory that came from reading orders under fire. The reason stated was simple: unauthorized medical intervention. Negligence. Insubordination. Violation of chain of command protocols. 20 minutes later, her badge was in a security office drawer. Her access codes were killed. Her name was deleted from the system. She was a ghost in Cedar Creek Medical, present only in the filing cabinets where Whitfield's fabrications were stacking up like ammunition. She couldn't tell them who she really was. Master Chief Petty Officer Laura Bennett, Naval Special Warfare Medical, operating under deep cover for the Defense Intelligence Agency. 6 months into a multi-hospital investigation targeting military-adjacent fraud networks that extended across San Diego, Camp Pendleton, and Naval Base San Diego. 3 other hospitals. 47 patients. A pattern of deliberate misdiagnosis and billing manipulation that, if exposed now, before naval intelligence had finished mapping the entire conspiracy, would tip off the network. The mission would shatter. The other doctors, other Whitfields, would scatter. The families that could still be protected would lose that protection. One child's life against hundreds of others. That was the mathematics of it. That was what sat in her chest like a piece of shrapnel that would never come out. At 3 in the morning, Laura sat in a booth at Mel's Diner on Pacific Coast Highway, watching the ocean turn colors it had no right to turn. The fluorescent lights above her bench were the kind that hummed at a frequency that made her teeth ache. She'd learned in Tikrit that some sounds were designed to weigh you down slowly. Break you from the inside out. Her coffee had been sitting untouched for 40 minutes. A skin had formed on the surface, grey and thin like compromised tissue. On the Formica table in front of her sat the tarnished military challenge coin. She'd flicked it an hour ago and it had spun there, catching the diner light, catching the reflected neon from the parking lot sign, catching the pain of 17 unanswered messages from her handler. Compromised? The first one read, "Abort?" The second, "Mission status?" The third, she hadn't responded because responding meant admitting that she'd chosen a dying 9-year-old girl over operational security. Over the bigger picture. Over the discipline that had kept her alive through 2 Purple Heart incidents and 73 combat operations. The discipline that was supposed to mean something. In the window's reflection, Laura saw a woman in scrubs who looked exactly like what she was supposed to be, a civilian nurse, tired, suspended, defeated. Behind that image, if you knew how to look, was Master Chief Petty Officer Bennett in Desert Camouflage, 2009, Tikrit, standing over a Marine whose leg had been sheared off at the thigh by an IED fragmentation. His name had been Wheeler. She'd held his hand for 4 minutes while his blood pressure collapsed. For minutes. That was what the mathematics bought you sometimes. A few more minutes with someone's hand in yours before they stopped being. The coin spun again where she'd flicked it. 18 months of work. Every pattern documented. Every fraudulent billing cycle traced. Every family that could be protected by exposing Whitfield and his network was hanging in suspension now, waiting for Laura to decide whether her career was worth more than their safety. She picked up the coin. Her hands were shaking now. Just barely. Just enough that she could feel it, that she could measure the tremor against the baseline of herself before Tikrit, before the deployments, before she learned that restraint was a weapon and composure was armor. But the tremor was real. The voice in her head was her handler's voice, professional and measured, the mission. You protect the mission. You complete the objective. You don't deviate. You don't improvise. You don't save one child if it means losing 100 others. She thought about Emma Mitchell's blue lips. About the exact moment when the pericardiocentesis needle had breached the fibrous sac, when she'd felt the subtle give of tissue under pressure, when the fluid had begun to drain and the pressure on Emma's heart had released and the pink had started to come back to the girl's face like sunrise. She thought about whether that one moment was worth the 6 months of careful investigation, the 3-hospital network, the families still waiting for the protection they didn't know they needed. The truck driver at the counter had been watching her for 10 minutes. She saw him in the reflection. Saw him look away. The diner's cook moved toward the sign by the front door, reaching for the closed placard. It was 3:52 a.m. Laura didn't move. She stared at her own reflection, 2 versions of herself, one legitimate and one not, one that could be suspended and one that could never be suspended because it didn't officially exist, and felt the weight of the choice settling into her bones like something that would never leave. The coin went back into her scrub pocket. It pressed against her ribs exactly the way it had for 14 years. A reminder. A warning. A ticking clock. She left cash on the table for the untouched coffee, stood, and walked toward the door. Through the window, the Pacific was beginning to turn gray. Not light yet. But the kind of gray that came before light, when the night was dying and you had to decide whether you were going to die with it or walk into whatever came next. 2 days. That was how long she had before the board made the suspension permanent. 2 days before Whitfield's fabricated reports became institutional fact. 2 days before the mission was compromised beyond recovery or before someone broke the silence. She walked into the morning knowing that whatever happened next would break something irreversible. The diner's lights went out behind her. The ocean was waiting. And in her pocket, the challenge coin was waiting too, tarnished, heavy, patient as a secret that was about to become something else entirely. 2 days later, an Iraqi translator named Rashid Ul-Tamimi arrived in Cedar Creek's emergency room with a construction injury, a steel beam crushing his left forearm, compound fracture just above the wrist, bleeding controlled by field pressure but the hand already pale from vascular compromise. The ER team mobilized around him with practiced efficiency, and Laura was restocking the trauma supply cart on the 3rd-floor corridor when she heard his voice calling out from the stairwell, accented English cutting through the steady hiss of the ventilation system. She didn't turn. She already knew what was coming. He was climbing toward her, one good arm gripping the railing, his eyes widening as she came into full view. "You are Valkyrie." The words landed like dropped instruments on tile. "You saved my brother at the Tikrit checkpoint. 2009, 3 minutes before the IED. My brother Hassan, you kept him breathing until the medevac landed. I was there. I saw your hands." Laura set down the supply box with the same measured precision she used for everything. She turned to face him, her expression neutral as stone. Rashid's face was streaked with sweat and dried blood, his breathing shallow from pain, and behind him came the security guard, retired Navy captain named Holloway, 23 years of service, rank of lieutenant, and Holloway went rigid. Absolutely rigid. His jaw locked. His hand moved automatically toward his radio and then stopped. Valkyrie was Master Chief Petty Officer Valkyrie. "That's you. That's actually you." The words came out as fragments, each one a verification. Master Chief Petty Officer Laura Bennett. 3 tours. You were the trauma surgeon running the forward base outside FOB Shank. The one who operated in a tent with no power half the time and saved more Marines than the official count even records. Within 20 minutes, Hospital Administrator Susan Reeves was sitting in a conference room with Laura's complete service file open on the desk in front of her, a classified file that should never have been accessible but that her naval intelligence handler had just placed there, each page a revelation, each one carrying weight like ammunition. 2 Purple Hearts. A Silver Star for Valor during a firefight while treating casualties under direct enemy fire. Commendations from Joint Special Operations Command. A medical degree from Johns Hopkins completed on military tuition while maintaining active duty status. 12 years of service. 3 combat tours. 18 months undercover at Cedar Creek. The administrator's face cycled through expressions, disbelief, understanding, and then something like shame at the suspension she'd signed just 48 hours earlier. Then Colonel Mitchell walked into the room. Air Force officer, full uniform, decorations across his chest like a map of service. He didn't sit down. He stood in the doorway and looked directly at Laura with eyes that had seen things that change you permanently. You pulled me from a burning Humvee. November 2009. Sanjin Valley. That was you. You stayed with me through a 6-hour firefight while I was bleeding out, and you didn't stop working until the bird landed. My daughter, she was 2 years old then. She doesn't remember a world where I wasn't alive because of you. Your hands held my life together. The silence in that room was the kind of silence that exists in churches and cemeteries. Long enough for understanding to settle. Long enough for shame to work its way into the small spaces where pride had been living. The video surfaced that evening. A visitor to Cedar Creek's pediatric ward had captured footage on their phone, 9 seconds of Dr. Raymond Whitfield throwing a stack of patient charts at Laura's feet, his voice cutting sharp through the hallway. "Pick that up, sweetheart." His condescension absolute. His hands casual as he dropped the charts like litter. The video was tagged with Cedar Creek Medical's official account name and his credentials. By dinner, it had been shared 20,000 times. By midnight, it was on every medical forum on the internet, every nursing subreddit, every hospital worker social media group in the country. The comments were savage. The shares multiplied like cells dividing under a microscope. Dr. Patricia Chen, legendary surgeon at Johns Hopkins, the physician who had personally trained Raymond Whitfield 15 years earlier, issued a statement before sunset. Before the sun went down and the words were already circulating. I have reviewed the video. I do not recognize the physician in this video as anyone I would have trained. I disown this behavior completely. The statement was clinical, precise, devastating, the kind of professional rejection that ends careers not with explosions but with cold silence. Within 4 hours, her statement had been picked up by medical board news services. Within 6 hours, it was in major media outlets. Within 8 hours, the hospital board had called an emergency session. The investigation unraveled fast. Laura's handler had brought documentation. Cedar Creek wasn't an isolated incident but part of a multi-hospital operation spanning 6 months, designed specifically to target fraudulent billing patterns hitting military families. Whitfield had been deliberately prolonging Emma Mitchell's hospitalization, cycling her through specialists he had financial agreements with, scheduling unnecessary tests, extracting maximum insurance dollars before planning his miraculous cure through a private clinic partnership with a cardiac practice in La Jolla. The fraud totaled $4.2 million just at Cedar Creek alone. 3 years of deliberate harm disguised as medicine. The board review took 4 hours. The termination took 2 minutes. The state medical board revocation of his license took 1 phone call. That was the worst part, watching him understand that it was over. Laura saw it happen from the pediatric hallway. Security escorting him out at 9:41 p.m., Whitfield carrying a single cardboard box of personal items, his face the color of old chalk. He didn't look at anyone. Certainly not at her. Emma Mitchell, already responding to the correct treatment, immunosuppressive therapy for the autoimmune pericarditis diagnosis that should have been identified months earlier, reached out and squeezed Laura's hand. Her small fingers against Laura's weathered ones. That's when you could see the difference between someone who heals and someone who profits from sickness. 6 months later, Laura stood in full dress whites at the Pentagon. The Military Healthcare Fraud Task Force ceremony, an auditorium full of officers and administrators and congressional representatives, all gathered to acknowledge the investigation that started with 1 sick child at Cedar Creek and expanded to 12 hospitals, 18 physicians, and $18 million in recovered fraudulent billing. 314 military families protected. Laura's citation was read aloud, commendation for service above and beyond normal duty, for maintaining her military oath while operating in a civilian environment, for prioritizing patient welfare over institutional loyalty. Emma Mitchell sat in the front row beside her father, wearing a t-shirt that said future nurse in bold letters, her face healthy and beaming in a way that 8 months earlier nobody would have thought possible. The child who had almost died under Whitfield's care now planning to save others. The challenge coin sat in a glass display case beside the podium. Polished now, all the tarnish removed, the worn aluminum gleaming under the stage lights. The plaque beneath it read, "For those who served twice." Laura's eye settled on it for exactly 3 seconds. That was enough. After the ceremony, Colonel Mitchell approached her in the hallway outside. "Congratulations, Master Chief. My daughter wants to go to nursing school because of you." Laura felt something shift in her chest. "Tell her it's the second best job in the world." The colonel tilted his head. "What's the first?" "Being the person who decides a child's life is worth more than a mission." Outside the building, rain was starting to fall on the concrete, and Laura walked past a strip mall anchoring the Pentagon parking area. At a folding table near the entrance, beneath an awning that was already sagging under the rainfall, a man in a wrinkled suit was selling supplemental insurance policies to people who barely slowed down to look at him. Raymond Whitfield. His eyes flicked toward Laura, tracked across her face, then immediately away. His jaw tightened. His hands went still on the insurance pamphlets he'd been sorting. He didn't speak. Laura didn't slow her pace. She had a flight back to San Diego, where Cedar Creek had reinstated her as pediatric clinical director, a new position created specifically for her, with authority over everything from curriculum to staff protocols to billing oversight. Rodriguez, the Navy corpsman who had recognized her months earlier, was now her assistant. The challenge coin had found its home in her pocket again, and she would carry it every single shift for the rest of her life, a reminder worn smooth by her own hands that the ones who have seen the worst often give the most. If this story resonates with you, if you've ever watched someone with true skill get underestimated by someone with just a title, please subscribe for more stories about the quiet heroes that institutions depend on but rarely acknowledge. Like this video and tell us in the comments, have you ever been judged by someone who had no idea what you were actually capable of? Your stories matter too.